Hello my dear children. Today we are going to discuss about one of the most interesting topic. We know the population of our country. We are going to beat China within few years. Now it's already more than 130 crores. So at the time of independence it was just only 30 crores. Now more than 4 times it is increased. What could be the reason? Lack of awareness about contraceptive methods, how to prevent pregnancy. Especially in poorer sector, people do not know how to give gap from one pregnancy to the other and how to stop pregnancy, they do not know. And one more striking feature is most of our Indian youth, they are, do not know how to prevent STDs. Okay, that's why some of them are having sexually transmitted diseases. Right? Why? Lack of awareness. Today, we are going to discuss about one of the important issue, that is how to prevent pregnancy. How to prevent pregnancy using contraceptives. The word contraceptive is nothing but birth control. See, how to control pregnancy. Okay, birth control method. Contraception. Conception is conceiving, that is getting pregnancy. Contraception against to conception. So the methods we employ to prevent pregnancy is called contraception, also known as birth control methods. Let us discuss what are the options we have to have control over the birth rate. What can we do? You see, we have different means. Some of them are natural means, some of them are burial methods, some of them are hormonal methods, some of them are surgical methods. We have various options. Let us see what are the options available for us. But before going to discuss about the options, we must know one thing. Any contraceptive a couple uses should have certain features. What are they? It must be very safe. Okay, it must be safe. It should be 100% effective. There is no chance of failure. There should not be any chance of failure. Then it should be free from side effects. No side effects must be there. And it should be available easily. Even in their villages, they should be available. For that, they need not go to metropolitan cities. Then it should be affordable. The rate must be affordable. Okay, and it should be acceptable to the user. It should not give any side effects or discomfort to the user. And finally, it should be free of effects on future pregnancies. It should not interfere with future pregnancies. If the couple who desires to have pregnancy, if they stop using contraceptives, there must be chance of getting pregnancy. That is very, very important. That means these methods must be a temporary methods, not a permanent methods. So these are the characteristic feature of any contraceptive, any effective contraceptive. Then only it would be a successful one. Okay, now what are the options available for us today? So we have natural method. In fact, here no contraceptive will be used. Simply following certain natural principles. And second one is barrier method. Barrier is obstruction. So obstructing the fusion of gametes by keeping certain physical barrier. That is barrier method. And IUD, intrauterine devices. So they will be kept inside the uterus. That's why they are called intrauterine devices. Then oral pills. Taking orally. Some pills are there. If they take orally, they will prevent pregnancy. Then injections and implants. Okay, that is another option. And we have finally surgical methods. So these are all different options we have. But one thing sure, Some options are suitable for some people, some are not suitable. Depends on the need of the couple. Okay, doctor will suggest one of the method. Right. Now, let us see how this contraceptive works. One by one we will take. First, natural method. You know, we have studied about the menstrual cycle, and on 14th day, ovulation occur. So, the chances of getting pregnancy will be more if the couple participates in sexual intercourse or coitus on that 14th day. See, 14th day is not a thumb rule. It can be either 2 days this side or that side. It can be on 30th day or 12th day or 16th or 17th day. So that's why if any couple desires to have pregnancy, if they participate in coitus or sexual intercourse, just 2 days this side and that side of 14th day. That means around 2 or 3 days. It would be more appropriate, you know. 3 days this side and 3 days that side. Totally, say 7 days. If they keep engaged in sexual intercourse during these 7 days, the chances of pregnancy would be more. That is for the couple who wants to have pregnancy. Then opposite, for the couple who do not want to have pregnancy, what to do? They should stop participating in sexual intercourse during this time. Understood? That's what we say periodic abstinence. Abstinating, completely stopping, preventing sexual intercourse during those 7 days. That is 3 days before ovulation, on the day of ovulation 14th day, and 3 days after ovulation. Totally 7 days. If the couple abstain themselves from participating sexual intercourse, then the chances will be very, very less. The chance of pregnancy will be less. That's a natural method. Then second one is withdrawal of penis, or we call it as coitus interruptus. Withdrawal of penis. When penis is to be withdrawn? You know, during sexual intercourse or coitus, at the time of ejaculation, male will come to know the time of ejaculation, because a peak stage in the sexual urge, okay, will be attained by the male. We call it as orgasm. So at that time, the orgasm precedes ejaculation. So just a fraction of a second before ejaculation, the male partner gets orgasm, sexual peak in the sexual pleasure. At that time, he withdraws his penis from the vagina and ejaculate outside the vagina, ejaculate the semen outside the vagina. That means the coitus process, sexual intercourse process, is interrupted. That's why it is called coitus interruptus. Okay. Withdrawal, simply the penis will be withdrawn at the time of ejaculation. Right. Now, next one is lactational amenorrhea. What is lactational amenorrhea? See, after parturition, after giving birth to baby, if the mother is intensively feeding the baby with milk, then certain hormones which involve in follicular maturation and further ovulation, we know FSH and LH. Those hormones will be stopped from the release from the source, that is the anterior pituitary. So when the woman is feeding her baby soon after parturition, almost up to 6 months, the chances of getting pregnancy are less. Why? During that period, the formation of ovum or a new ovum or ovulation, the chances are very, very less. So getting pregnancy will be less. So during that period, if the couple participates in unprotected sex, the chance of getting pregnancy will be less. So these are all natural methods. So no additional device or chemical or anything is being used by the couple. That's why it is called natural method. Now, coming to the next one, barrier method. As I told you, some physical barrier we are arranging between male gamete and female gamete. Suppose if there is no physical barrier, they may fuse with each other and fertilization occur, leading to pregnancy. So what can we do? Some barrier we have to arrange. So that is barrier method. It can be even chemical. It need not be a physical barrier. Some chemical barrier also can be arranged. Okay, which can kill any one of these gamete, preferably male gamete. There are some chemicals which can kill the male gamete, so that there is no chance of fertilization. So this is the barrier method. So in this we have condoms. We know, most of us know, it is easily available. And diaphragm, cervical caps, walls, these are all different types of barriers. We will be learning about these barriers now. You see here, it is the barrier is either physically or chemically block the sperm from reaching ovum. It's not allowing the sperm cell to reach the ovum. Now, indirectly it is acting as a barrier between you and your sexual partner. You will be having physical contact, but skin to skin direct contact will not be allowed in this barrier method. Okay, it will be very clear to you if you go further. Now, barrier have an important use. They can prevent you from STDs, sexually transmitted diseases, like HIV, syphilis, gonorrhea. Right? So this is the additional advantage of using barrier like condoms. Now, what are the different types of barriers? Just now, we learned that there is a condom. This is the male condom. Okay, it is made of latex. It is available like this in a packed form. So this is pack. Pack is open. Condom is taken out. Now it is just opened and inserted arranged to the penis. The condom need not be white in color. It can be in different colors. It is available nowadays. It is available in different colors with different aroma. They give different scent. Okay. Now, so this is the way how a condom is arranged. So this is the form in which it is available, and it is arranged to the penis like this, inserted to the penis. Then he can participate in sexual intercourse, and the semen is collected at this tip, so that the semen won't get any chance of going into the uterus, going out to the cervix, and there is no chance of making entry into the uterus. It remains inside this tip only. Suppose if it is damaged, if the tip has minute pores, then there is a chance of leakage of sperm cells. But standard condoms will not have any structural defects or manufactural defects. Now, condom is available for female also. This is a female condom. So this female condom, one side it has a small cup-like structure and other side it has an opening. Now how this is arranged? You see, this is the way a female condom is arranged. So it is just open and it is inserted in her vagina, so that this closed end, which is cup-like, covers cervix, and open end is located outside the vagina, so that she can have sexual intercourse freely with her husband, and whatever the semen collected will be here only. It cannot enter into the uterus for fertilization. Right. One thing is very, very important. So here, this is the way. This is a close-up view. So once the sexual intercourse is over, it will be removed. In the male also, condom will be removed and they will be thrown out. So they are only they can be used only once. Okay, they are disposable. They cannot be reusable. Only one time they have to be used. After that, they have to be disposed out. Now, what are the benefits of condoms? As I told you, so they protect you from STDs also, and they can be inserted by oneself. For that, they need not go to doctors, and it is user friendly, and the cost is also very cheap and easily available in any small medical shop. Okay, and we know Nirod is a popular brand of male condom available in the market today, and condoms will provide partner privacy. Understood? So that's why most of the people use condoms. Now, coming to diaphragm. This is also another type of condom. Diaphragms, cervical caps, walls. There are also barriers just like your condoms. They are made of rubber and they are inserted into the female reproductive tract, and they also cover the cervix during coitus. So how they prevent pregnancy? They prevent pregnancy by blocking the entry of sperm cells. So that is the way how they prevent pregnancy. Just like condoms, only they work. Now, all those condoms, barriers, they are all physical barriers. Okay. Diaphragm, physical barrier. But here, whatever you see, it's a chemical barrier. That means it's a chemical which can kill sperm cells. Say, these chemicals are available in the form of creams, in the form of some jellies, sometimes foams. Just before 1 hour of sexual intercourse, the female applies this either cream or jelly or foam into her vagina. Then after 1 hour, if she participates in sexual intercourse, even the sperm is ejaculated. This chemical can kill the sperm cells so that the chances of entry of sperm cell into fallopian tube will be almost remote. And some couple use spermicidal chemicals and condoms together, because suppose during sexual intercourse, if any damage occurs to the condom, there is a chance of leakage of sperm cells. If any manufacturing defect is there is a chance of leakage of sperm cells. That's why simultaneously they use spermicidal chemicals also, so that if any such thing happens, accidentally the sperms are released, they will be killed by these chemicals. So either physically or chemically, we are preventing the sperm cell to reach ovum. That's all. This is second method. So natural method we have discussed, then barrier methods we have discussed, then let us go to hormonal methods. See, hormonal methods, how do they work? They interfere with the hormones of female. So, you know, female hormones are two types, estrogen, progesterone. So these two hormones play a vital role in her reproductive cycle. Now, hormones interfere with those, these hormonal methods interfere with the release of those hormones. Now, especially interfere with the release of hormones, thereby ovulation or implantation of embryo. So either this method can interfere with the ovulation process, so ovum cannot be released, or if it is released, even fertilized, the fertilized one, that is a zygote, which is undergoing developmental process, cannot implant to the wall of the uterus. Like that, these methods prevent pregnancy. Right? Now, but the drawback with this method is it cannot offer you any protection from sexually transmitted disease. That's all. Right. Now, we have different types of hormonal methods here also. So for example, birth control patch. See, which is a highly efficient, 91 to 99% efficient in preventing pregnancy. And how it is used. Just I will show you. This is a patch, birth control patch. See, very simple, either in the upper side or the back side of the body or in the abdomen region, just they have to arrange. Okay. How long it should be kept? It should be kept for 3 weeks, 21 days. After that, it should be removed and give a gap of 1 week. During that 1 week, the woman will get menstruation, and after that, after 1 week, again a new patch will be arranged either here or in the abdomen region. How this patch prevents pregnancy? See, this patch releases hormones progesterone and estrogen, small doses, which will interfere with the ovulation process. Okay, and prevents pregnancy. So it is very safe to use. This is a birth control patch, and we have one more such arrangement, but it should be that should be inserted inside the vagina. We call it as vaginal ring. Okay, I will show you how to arrange that one. This also releases estrogen and progesterone. It is also 91 to 99% effective in preventing pregnancy. Now, how it is arranged? You see here. This is the vaginal ring available in the pocket. It is removed, and that ring is inserted into the female genital tract vagina so that it reaches the mouth of uterus, that is cervix, and holds the cervix like that. And slowly it releases estrogen progesterone hormone and interferes with the ovulation. So like this, it controls pregnancy. Okay, now this is also should be kept for 3 weeks. After that, it should be removed, and they have to go for a new ring in the 5th week. That means first 3 weeks, one ring, 1 week gap. During this gap, the woman will get menstruation. Again, 5th week, she has to start new ring. Again 3 weeks, 1 week gap. Like that they have to use. Now, same way as the previous one we discussed, it cannot offer any protection from STD. It can prevent pregnancy. Efficiency is 91 to 99%. Okay. Now, see, this is a birth control shot. Okay. This is for every 3 months, not 3 weeks. Every 3 months, doctor will administer a small injection. Okay. It is 94 to 99% effective, and it doesn't offer any protection against STDs. This one example, Depo-Provera 150 mg. So it's a hormonal preparation which will be inserted in the which is injected into the female. You see, all these hormonal methods are meant for female only, whereas the previous barrier method condoms are meant for both male and female. But here, hormonal methods are employed only for female. Remember. Now,